Welcome to Take 5, an inventory series where we go out into the world on the hunt for news and studies related to healthcare's supply chain, then bring back the juiciest pieces to feed our family, which includes you. Whether you knew it or not, congratulations. I'm Alex Diamond, and I recognize that I've got a rare privilege. I work for a company that has continued to work with and in hospitals throughout the coronavirus crisis. That may not sound exciting, but many vendors and hospital partners don't have that opportunity at the moment. So, in part 1 of our series about vendor relations in the era of COVID-19, I asked our VP of Operations and Client Services, Curtis Dietrich, what preparations our company and others should make before they approach a hospital right now.
Masks have definitely become kind of the baseline. Like, you got to walk in with a mask. As supplies have been restricted, more clients are saying, are you able to provide your own PPE versus before it was very common, just, oh yeah, here's the PPE. In recent conversations, the requirements have kind of expanded, and there are even and some of this depends on what client you're dealing with, but talked to somebody yesterday that their expectation is that you have been tested to go into certain areas, and they are saying that they will help provide those tests. Of course, we know that there's a period for that testing to be done, so that's one of the things we're now having to at least plan for, is if that client is going to require that those people have all been screened for COVID itself. You have to wait for that test to be performed and then the results to be available. We've had to be more responsive to do things quickly, as they have either freed up resources or wanted to get things done before electives came back. I'd love to say that, yeah, now I'm getting an extra week to go through all that, but the reality of the situation is, of course, lead times never get to be extended much. I would say it's more just adding items to the list of things that need to be done quickly to get to where we need to be with the project. And so those are things that are just now really starting to be discussed in detail. That didn't happen initially because they didn't really have availability of testing or an understanding of exactly where they thought the exposure risks might exist. But it's starting to become a conversation point. Having that stuff ready or not has not been really a limiting factor yet. I think, again, as they get to more regular process and standards are established for that you'll start to see that just included as another thing that you do. Right now, it's been a mixture of, well, we have to have this before you can show up, versus, yeah, we want that. If you don't have it, we'll have to do this, or you won't be able to do this, and we work around those details. The other kind of change that I see is more adoption and enforcement on kind of the vendor credential screening services. And that's just going to it's leveraging an existing process to make sure that the people that are coming in have been screened, they meet whatever requirements they may have. Vendors are now seeking antibody tests that they can then add to that pack to say, well, I was, COVID negative 2 weeks ago, or I do have antibodies and that was from a month ago. As just the science behind the disease becomes more known, they'll have a better idea of what time frames and what levels of exposure and what kind of things they're going to want to see. But that is all being developed in real time, and I'm sure we'll shift as we get more familiar with the details.
That's it for this week. Join us next time when we talk about how day-to-day operations and vendor access within healthcare facilities has changed. Take 5 is a production of Z5 Inventory. To see all the sources and resources for this episode and more, visit z5inventory.com. That's the letter Z, the number 5, and the word inventory.com.